A deep dive into drug alcohol abuse during adolescence. What is habit formation? Habits are routines or rituals that are unconsciously done or that have become almost automatic or second nature. A habit is a practice that is repeated so regularly that it can be difficult to change. Habits are the actions that are initiated by cues, stimulus, such as a time of day, an activity, or a location. They result in the feel good reward that, through repetition, makes the connection between cue and reward firmly in the brain. That means habit, the rewards associated with the habits are the main reason why habits can't be changed. How habits are formed. The habits we embrace is the result of the fact that we are wired programmed to seek out pleasure. The habits are capable of delivering a hit of dopamine, our brain's reward chemical. When we once feel better after doing some action, that action becomes a habit, that is we crave for more in order to feel good. How habit develops in brain. When your brain recognizes a relation between action and satisfaction, it documents that information in area of the brain which is called the basal ganglia. This is also the area of the brain which is responsible for emotions and memories, whereas conscious decisions are made in the prefrontal cortex. What is drug alcohol abuse? The use of illegal drugs or the use of prescription or over the counter drugs or alcohol for purposes other than those for which they are meant to be used or in excessive amounts. Substance abuse may lead to social, physical, emotional, and job related problems. A child's natural curiosity motivates him/her to experiment. This is complicated further by the bizarre notion that there are benefits of alcohol or drug use. Thus, the beginning of first use of drugs or alcohol may be out of curiosity, but later child starts using these to escape facing problems. Stress, which occurs from pressures to excel in academics or examinations, has played a significant role in promoting youngsters to go for alcohol drugs. What happens in drug alcohol abuse? Due to the perceived benefits, drugs are frequently used repeatedly. That means the drugs are consumed repeatedly to produce profound effect on mood and feeling of behavior. Addiction studies have found that drug cravings increased levels of the neurotransmitter dopamine in the nucleus accumbens, a part of the brain associated with reward. Addiction is deemed to be psychological attachment to certain effects such as euphoria and a temporary feeling of well-being, which are perceived by adolescents to be associated with drugs alcohol. These effects of drugs alcohol cause people to consume even when these are not needed or even when their usage becomes self-harming. That is, these drugs are consumed in unnecessary quantities. But caffeine in tea, coffee, and cold drinks do not do serious harm on repeated use. With repeated usage of drugs, the tolerance of level of the receptors present in our body increases. As a consequence, the receptors display the pharmacological effects of drugs or alcohol at higher doses, leading to greater intake and thus addiction. It should be borne in mind that once these drugs are used, can lead to addiction for long period, even lifetime. Thus, the drugs and alcohol teleports the user into a vicious circle, leading to their regular use abuse, from which he/she may not be able to remove himself/herself. Plants involved in drug abuse. The drugs which are responsible for drug abused are opioids, cannabinoids, coca alkaloids. Opioid, opium poppy. Opioids. These are drugs which bind to a specific opioid receptors present in central nervous system and gastrointestinal tract. Heroin, which is called smack, is diacetyl morphine, which is obtained by acetylation of morphine. Morphine is extracted from the latex of poppy plant Papaver somniferum. Heroin is taken by snorting and injection and is a depressant which slows down body functions. Heroin is the most dangerous drug as it causes addiction, which includes both psychological and physical dependence. That is why the manufacture, sale, and distribution of this drug is banned. Cannabis sativa. Cannabinoids. We get natural cannabinoids from the inflorescences of cannabis sativa. These are a group of chemicals which have interaction with cannabinoid receptors chiefly located in the brain. We get marijuana, hashish, charas and ganja from flower tops, leaves and the resin of cannabis plant. These drugs have been used by individuals for the strange feeling and experienced by changes in thought perception and mood behavior. These have effects on cardiovascular system of the body. Cocaine. Cocaine is obtained from Erythroxylum coca, which is native to South America. It interferes with the transport of the neurotransmitter dopamine. It is also called coke or crack. It produces a sense of euphoria and increased energy by a potent stimulating action on central nervous system. It causes hallucinations which when dosage is excessive. Other plants are Atropa belladonna and Datura, which possess hallucinogenic properties. Medicines involved in drug abuse. Barbiturates, amphetamines, benzodiazepines, and other similar drugs used in mental illnesses like depression and insomnia are prone to being abused. These drugs are to be taken only on doctor's prescription for the treatment of a disease, but one of the reasons for their misuse is their easy accessibility. Morphine being sedative and painkiller and being useful in patients who have gone through surgery cause physical dependence by causing euphoria. Physical dependence. Dependence can be described as the tendency of the body to manifest a characteristic withdrawal syndrome which is unpleasant if regular dose of drugs alcohol is abruptly discontinued. The withdrawal syndrome can also be called abstinence syndrome. It can be characterized by anxiety, shakiness, nausea and sweating, which when use is resumed again, these symptoms may be relieved. In some cases, withdrawal symptoms can be life-threatening, leading to the requirement of medical supervision. Dependence leads to ignorance of all social norms in order to get sufficient funds to satisfy patients' needs. These result in many social adjustment problems. Addiction at receptor level. Addiction is an attachment at psychological levels to certain effects such as euphoria and a temporary feeling of well-being which are associated with drugs and alcohol. These fake pleasant effects drive people to take these drugs even when these are not needed or their use becomes self-destructive. With repeated use of these drugs, the tolerance of the receptors present in our body to these drugs increases. Consequently, the receptors possess response only to higher doses of drugs or alcohol, leading to their greater intake and thus causing addiction. Warning signs of drug and alcohol abuse among youth. Decline in academic performance. Their absence from school, college, which cannot be explained. Absence of interest in personal hygiene. Mental problems like withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, losing interest in hobbies, manifestation of change in sleeping and eating habits. In addition, youth also experience deterioration in relationships with family and friends, changes in weight, appetite, etc. Adverse effects in terms of relationships. If an abuser is unable to procure money to buy drugs, alcohol, he/she may get involved in stealing. A drug alcohol addict will become the reason of mental and financial distress to his or her entire family and friends. Disadvantages of drugs taken intravenously. Those who do drugs consumption intravenously, direct injection into the vein using a needle and syringe, are much more liable to serious infections like AIDS and hepatitis B. The viruses responsible for these diseases are conveyed among individuals by sharing infected needles and syringes. AIDS and hepatitis B infections are chronic infections which lead to death. Adverse effects of consuming alcohol during adolescence. It can result in heavy drinking in adulthood. The overusage of drugs and alcohol leads to nervous system damage, and liver cirrhosis. When used during pregnancy, drugs and alcohol adversely affect the fetus. How drugs are misused in sports persons. Sports persons misuse narcotic analgesics, anabolic steroids, diuretics, and certain hormones in their career to increase muscle strength and bulk, promote aggressiveness, and due to this, there is increase in athletic performance. Side effects of anabolic steroids in males and females. In males, acne, increased aggressiveness, mood swings, depression, reduction of size of the testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland. These effects may be permanent with prolonged use. In females, masculinization, features like males, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on the face and body, enlargement of clitoris, deepening of voice. These effects may be permanent with prolonged use. Adverse effects of drugs in adolescent male or female. Severe facial and body acne. Premature cessation of the growth centers of the long bones may cause stunted growth. Motivational quotes that will help you deal with stress. Confidence and hard work is the best medicine to kill the disease called failure. This makes you a successful person. The harder the struggle, the more glorious the victory. Those who have faith in themselves, then even fear gets scared of them. The greatest success in life comes from doing what people say you cannot do. The 6-step content framework. Headlines. These headlines can make or break your content. Good headline attract more interested audience. Introduction. The good introduction can make the interested audience to read your content further. Use ARB formula, that is attention, reason, benefit. The what. A brief description of the problem your audience is facing and solution for the problem is included. The why. Describe why your solution is the best solution for the problem your audience is facing. The how. Describe how to implement your solution easily. Conclusion. Conclude with a summary of your content and encourage your audience to take some action, like doing some comments or expressing their views. Assignment for week 2. Write the content stating why it is necessary to eradicate drug abuse and how we can prevent the menace of drug abuse. Minimum 400 words are required.